Why do you think in so many countries when they legalize cannabis for medical purposes, we have such a delay in prescribing cannabis to the patients?
Absolutely, you're absolutely right. There is a huge delay for availability of cannabis for medical purposes, even in the countries where they fully legalize for medical purposes, like in the United States, like in Israel, and many other countries. Germany is just last year, Britain just this year were allowed to use cannabis. And no license in Britain. I was in Britain 3 months ago, no one license there. They allowed, but doctors are not participating in this process. They're just afraid, they do not have any good information. They studied during the brainwashing and demonizing cannabis. So we need to change, to help them, or to small minority of them. They were ready to change their mindset. I'm third generation of the doctors. So 3 my generations of my parents and their relatives, they were doctors, they were brainwashed, they saying the cannabis is dangerous narcotic drug. I suppose my late father, he knows about me that I use cannabis for say, you are making your clients addictive. So this is a huge criticism of older population, older doctors who possess all relevant positions. Chief of departments, chief of the hospitals, head of the professional association. All professional associations from all over the world are standing against cannabis. So how you can resist it? It is very few doctors in the world. Till now, we are not more than 1,000 doctors in the whole world. This is a very, very small proportion of the doctors. You should understand, out of the millions of doctors working in the world, there are very few doctors are ready to support this system. And we need to support them. We need to provide them very good training and advanced training in the understanding, and to bring doctors inside, to bring regulators inside, to bring medical health organization inside, to bring public money in order to make cannabis affordable to the patients. So we need to bring much more sources and factors together in order to go further. Otherwise, it will be huge delay. We need to change the views of the regulators and governments first. Otherwise, until the regulation is saying no, you could make many schools of medical cannabis here, like I participated 2 years ago. Nothing really will be changed until your government will decide that cannabis is okay and will issue some regulation. You see, in the cannabinoid system, this is a system that was discovered fully, as much as possible, fully 20 years ago. So, majority of the doctors who are in your practice, medical practice in your countries, majority countries, studied in their medical schools, internacy and residency, have never heard about it. No textbook, even till today, no textbook for medical school contain any chapter about cannabinoid system.
Is it important for a psychiatrist that he understands how the endocannabinoid system works in order to understand what can be achieved with cannabis treatment?
Frankly speaking, cannabis and its products is a very valuable instrument for us psychiatrists, neurologists. I suppose myself as a neuropsychiatrist, as a specialist in brain function. And this is why I suppose that cannabis could be very valuable as a treatment of various psychiatric and neuropsychiatric disorders, like you mentioned, OCD with repetitive behaviors, obsessive compulsive disorder, tic disorders like Tourette disorders, many other motor disorders like Huntington disease, Parkinson disease, agitation within Alzheimer's disorder. So we can use cannabis as a very, very useful substance, but we need to understand the complexity of this usage. I will say, is it important to driver to understand how the engine of your car is working? Is it important? Yes. Is it so necessary you to be a good driver? No. This is for us. We should understand that we have an endocannabinoid system. It's a working system, but we can continue our practice based on the general assumption we understand what we are doing, and we are able to have a shared decision with the patients and his caregivers, and to stand behind this decision.
So what kind of support do you provide to your patients parallel to cannabis treatment?
I have some veterans, they smoked for many years. When I will even try to ask them would they would like to withdraw the smoking, he said no. So I don't want to argue with them. I should follow their decision. They know everything about the harm that they cause to their health using the cigarettes, nicotine, and also they use cannabis by the smoking. If I like it, no, I don't like it. I don't like smoking cannabis as I don't like smoking it, but I don't argue my patients. I follow up them, try to find for each patient, for his clinical situation, the optimal for himself regime of the cannabis. It's different dosages, different way of administration. We discuss it with him. It should be suitable for him. It is not the same recipe, same approach to all patients. This should be very differentiated from one patient to other. I suppose this is a wise, pragmatic approach.
Is this also challenging for medical profession because the
yes,
protocol
absolutely.
of prescribing is
absolutely right. I suppose this is a crucial question because the requirements of the treatment in this area are so unrealistic that majority of the doctors prefer not to deal with cannabis because of so large demands of Ministry of Health, healthcare organization, that they say, okay, I have so large caseload, I don't want to use cannabis because it places on me a lot of responsibility and I have very few time in order to bring any kind of relationship with patients. I have no time for discuss with patients, his caregivers, his relatives, what the way of delivery. I don't want to do it. Just this is one of the main reasons where the doctors do not want to collaborate with any kind of cannabis. And this is the reason that majority of the cannabis treatment had been provided only in private settings, because of private settings permit patients to choose doctors. A doctor has time for him, hear him very carefully, listen to him very carefully, provide very positive attitude. Why? Because patient paid for it. This is why. And unfortunately, this is a system, because in public system it's different, absolutely different, exactly like you said.
We had a great opportunity also to hear the lecture of Inbal Sikorin. She made an example how the nurses could also support a lot this treatment with cannabis.
Many years ago, I worked with her in this nursing home. I was a practical neuropsychiatrist, psychogeriatric in this nursing home. I fully confirm her finding. It's also my finding that we were able to reduce psychotropic medication in the majority of the patients. They are much older than 80 years old, and we reduce from them painkillers, sleeping drugs, antipsychotics medications. Was my work, and together with geriatrics there, he reduced antihypertensive medication, anti-diabetic medication, because they balanced. The cannabis balanced the treatment. They didn't need more synthetic medications. This is, and nurses were the primary treatment factor in the hospital. I can fully confess it.